course, anytime you're using any of the machines, you always want to make sure you're using it over clean skin, never over dirty skin, because both of these machines can penetrate product into the skin. So we're going to go in and cleanse her face. I'm going to use a clarifying cleanser that'll help to degrease the face as well. I'm just going to go ahead and do one cleanse on her. But you can also feel, when you're cleansing, you can feel areas of congestion that are on her face. I really at first didn't think she had a lot of congestion, but she really does. And so the ultrasound skin scrubber is going to help with that. Her face is going to feel a lot smoother. Around into the nose area, especially in the nasal fossa, or that depressed area of the nose, a lot of oil congestion in there. The ultrasound skin scrubber is going to help to purge all that out as well. One of the probably complaints I would say that you get from skin scrubber after the skin scrubber is if you don't put a good moisturizer on afterwards, their face will feel too dry. So because we are purging out all the extra oil out of the follicle. So make sure that you're using a good moisturizer on them afterwards. Aloe vera is a good conductor for your ultrasound, and it doesn't tend to irritate anybody's skin. Every once in a while you might find a client who might be a little bit sensitive to aloe vera. I think in my whole career, and I've been in business many, many years, I've found 2 people who are sensitive to aloe vera, but you can use something else other than aloe vera at that point. Any kind of a gel type of a solution would work just fine. I like the clear gel because I find that I like to see what's coming out of the skin as I'm working with it. Another thing, make sure that your aloe vera that you're using is a pure aloe vera. And I start off with the forehead first. And I lay on about a flannel thick of the aloe vera to the area. And then with my machine, my tool, I want to hold it so that your tool, it's a 45-degree angle. We're going to hold it so that it just dimples the skin. And you guys can come around here a little bit closer if you want to. Okay. And the power switch is right here. So we turn the power on, and then I select. If I'm going to penetrate products, I would have the positive or negative, whether I'm using a acid solution or an alkaline solution. But I'm going to turn on the peel, which is right here. It's already working. You can hear it kind of a little buzzing to it. And I usually like to start from the center of the forehead, and I come across nice and slow, keeping my tool or the blade at about a 45-degree angle. And it's really important when you come in here into the temples. And I'll wipe that off. As I come to the temples, a lot of times people will come in here into the temples and they forget to lift their blade up. So you're not getting that 45-degree angle. So lift the blade up so you're at the 45-degree angle. Nice and slow, working all the way up into the hairline. I find that you've got larger sebaceous glands in the hairline, and a lot of times people will get little hair bumps in that area, so this is good for that as well. Wiping off my blade as I go. Now you can use your other hand or twist your arm around, whatever's more comfortable for you. I like to use my other hand, coming across at a 45-degree angle, keeping it at that angle. If somebody's skin is really congested, a lot of bumps, a lot of oil in a follicle, and I think I need to go over it more than once, I can. The skin will tell you when it's too much. How does the skin tell you if it's too much? It turns red. So now I'm going to put a little bit more on here. I'm going to go in the opposite direction. So I'm going to come from the outside to the center, holding this at a 45-degree angle. Usually what you'll notice is that the second time you come around, you won't have the aloe vera gel won't be as cloudy. Also, if the skin is really congested, you'll actually hear the machine bog down. It's kind of like if you're mowing your lawn and you hit some really tall grass or some wet grass, your lawnmower kind of has to work a little bit harder, or the machine, the lawnmower kind of bogs down with it. This machine will also bog down when you come across really congested skin. So you listen for that sound as well, and you don't want to go too fast, but you don't want to go too slow either. Going too slow, because this does vibrate at about 24 to 26,000 times per second, can cause some irritation to the skin. So you want to keep it moving, right? So we finished the forehead, and you'll notice now that she has a little bit of redness, a little pinkness, because this ultrasound has a thermal effect, so it is going to give out a little bit of redness to the skin, and that's normal. Now we're going to go down onto her cheeks. And when you're dealing with ultrasound, stay outside of the orbital bone of the eye. So I don't want to do the eyelid. I want to stay into that orbital bone, right around into that eye socket area. Because the eye is made with lots of fluid and water, and you can actually cause too much vibration. So I stay on the outside, holding this at a 45-degree angle, coming with the hair growth. And you may even notice how cloudy the aloe vera got when we're working over her skin. Even though we cleaned her face really good, I used a good degreasing type of a cleanser. She still has a lot of oil into the follicles. I actually use the tool with the follicle, against the follicle as well. I use it both ways. I find you get a better exfoliation, better purging of the follicle that way. So what I mean by that is I'm going to follow the direction of the hair on her face with my first pass, and then I'm going to go against the hair growth with my second pass. So now I'm going against the hair growth, still keeping at that 45-degree angle. And remember, don't apply pressure. The weight of the tool does that for you. If you apply pressure, you're going to irritate the skin, and their skin's going to get all red. And sometimes I've even seen welts when people apply too much pressure. It's better to go over light and go over a couple of times in an area that's really congested versus trying to apply pressure. In the direction of the hair growth. And again, I love this tool because you're not tethered with a power cord. And it's a lot more mobile. Sometimes estheticians don't have power plugs right next to their table or their facial chair. So it's nice for that reason as well. Or if you're a mobile esthetician. Now we go into the nose, down the center of the nose, and it fits in there nice at a 45-degree angle. You come right down the tip of that nose, and then the edge has a rounded edge to it, so you can get down into the nasal foci. So I'm using the edge of the tool, coming down the side, taking that rounded edge right into that depression of the nose, and right on into here. And it really cleans really deep into there and getting all that oil out. I'm going to go over the tip of her nose. We're going to come. A lot of times people have little microcomedones here at the end of the nose, and the nose looks smudged. And this is going to purge all those little microcomedones out. So I'm going to go actually against the nose too, coming back up. So I really like, I don't know who invented the shape of these, but they really did a good job doing it. When I work on the chin, I have the client purse their lips in, so you pull your lips in a little bit. The hair on the chin normally grows down, so I'm going to come down. Coming down at that 45-degree angle, come around that curve, make sure to bring this up so it stays at a 45-degree angle from the face. And you can see she's getting a little bit red there, and that's normal. And now pull your lips again in one more time. I'm going to go against the hair growth. Great. Okay, very good. Now you can do the upper lip as well, but the upper lip doesn't have as many or as deep-seated oil in there, the sebaceous glands. So a lot of times I don't like to do that upper lip because it dries it up too much. And then I'm going to go in and rinse the face. And remember, your ultrasound gives a massage, so you don't give a massage to the client. It's already a massage in itself. And at the end, you just go ahead and toner. And apply some moisturizer, some SPF.